Good afternoon. Apologize for the previous stream. Hopefully it's working now. We had an audio issue. Welcome to the press conference hosted by the Iroquois County Public Health Department and the Iroquois County Board. My name is Eric Stacey. I'm the Iroquois County Emergency Management Agency Coordinator. I'd like to remind all those present to please silence your phones and any ringers that you may have. And without further ado, I'd like to introduce Iroquois County Public Health Department Administrator D.M. Shipper.
Thank you, Eric. The Iroquois County Public Health Department has confirmed the first positive case of novel coronavirus disease, also known as COVID-19, in an Iroquois County resident on March 26, 2020. This individual was tested March 23rd by a medical provider. Laboratory confirmed results were received today. The individual is a man in his 50s located in Iroquois County. The individual is at home, is doing well, and is cooperating with public health officials. He will remain in isolation per Illinois Department of Public Health guidance. At this time, we are not providing any additional details on the individual. Public health officials are evaluating exposures and will notify those we determine to be at risk of exposure. The situation is fluid. Guidance and recommendations regarding patients under investigation may evolve as more is learned. It is important to remember that even though there has been a confirmed case, this is not cause for panic. We strongly recommend to continue social distancing and other safety measures, which include stay at home as much as possible with adherence to the governor's shelter-at-home requirement. If gatherings are absolutely necessary, limit the number of people to 10 or less. Call to check on family members, neighbors, and older adults instead of visiting. Check with your provider about telehealth options if you feel ill. Remember to continue using proper hand hygiene. We keep telling you over and over, hand washing, wash your hands, wash your hands. Cover your nose and mouth with a tissue when sneezing or coughing. Dispose of the tissue immediately. And if no tissue is available, sneeze or cough into your elbow. Do not shake hands. Instead, use another non-contact method to address others. Clean frequently touched surfaces often. And most importantly, if you are sick, stay home. If you have a respiratory illness, stay home for 7 days after your symptoms have started and for 3 days after your fever has stopped without the use of fever-reducing medications and your cough or sore throat symptoms have improved, whichever is longer. Avoid the emergency department and other places you seek health care if you are not severely ill, unless your doctor advises otherwise. Stay home and keep health care access available for others with more severe illness. And at this time, I'd like to introduce to you Dr. Zumwalt, who's the Iroquois County Public Health Department's Medical Director.
Thank you, Dee. We recommend consulting with your doctor if you have the following: significant fever, cough, shortness of breath, or other cold or flu-like symptoms, and if you not feel better after 3 or 4 days. It's better to use telephone, text, telemedicine, or patient portals to reach out rather than going to your doctor's office if possible. If you're an older adult or have chronic conditions of concern, heart disease, diabetes, lung disease, significant smoking history, and are exhibiting mild symptoms, your provider will decide if you need medical care or testing. You usually do not need to be tested unless you are admitted to the hospital at this time. Thank you.
And now I'd like to introduce Iroquois County Board Chairperson, John Schuer.
Thank you, Eric. On behalf of Iroquois County, I would like to thank our local partners for their diligent efforts to prevent the spread of coronavirus within our community. We appreciate the cooperation and sacrifice of local businesses and community members at large in practicing social distancing. With no vaccine available, this is our best response to slow the spread of COVID-19.
Thank you, Mr. Schuer. The Iroquois County Public Health Department is working closely with Illinois Department of Public Health and numerous local organizations, including Iroquois County EMA, Iroquois Memorial Hospital, emergency responders, including EMS, law enforcement, fire departments, and 911 dispatch, and several long-term care facilities. Each morning, these organizations are brought together virtually through the Iroquois County Emergency Operations Center to conduct briefings, communicate needs, and coordinate efforts. This cooperation ensures Iroquois County's joint preparedness for and response to COVID-19. For general questions about COVID-19, call the Illinois Coronavirus Disease Hotline at 1-800-889-3931 or send an email to dph.sick@illinois.gov. Anytime, 24 hours a day, 7 days a week. For information on actions you, your school, workplace, and community can take, please visit Preventing COVID-19 Spread in Communities at the Illinois Department of Public Health's website. For daily updates on COVID-19 in Illinois, please follow the coronavirus.illinois.gov website that's been set up by the state of Illinois. At this time, we'll take questions and answers. If you'd like to ask questions, raise your hand, please.
Will there ever be a time where you would talk about the geographic area of where this person is?
Okay, I'm going to refer that to the Department of Public Health. Thank you.
We have decided at the Iroquois County Public Health Department to allow the individual who has tested positive to remain as anonymous as possible. So out of respect for him, because he has been extremely cooperative with our health department, we will not be releasing that information at any time, and I don't foresee doing that in the future. I do think that it's safe to assume that it's everywhere and has spread throughout all communities. If you look at the numbers for our neighboring counties, some of them have had numerous cases. So I think it's a fair assumption to assume that coronavirus is out there.
Questions?
Somebody else say in case they have more.
The only other question that I had is, from what you have seen from the social distancing around here, are you guys satisfied with how people are adhering to the executive order and everything, or other areas? I don't want to call anybody out, but I mean, social distancing, are we doing a good job here, do you think? Or?
Sure. Once again, let me let you take that.
I have been extremely pleased with the cooperation that we have received from Iroquois County residents and businesses.
Mm-hmm.
What we're doing is going to make a difference. It actually is making a difference. When the gubernatorial executive order came out and they listed essential service businesses, we were extremely busy fielding phone calls from businesses that wanted to know if they were considered essential services. Everybody wants to be considered an essential service, and we understand that. No, this is a difficult time for people, especially if people are sheltering at home and not able to work. And for those individuals who are not receiving pay, it is difficult, and we understand that. We would never, at the health department, never want to do anything to hurt our own community businesses. But our priority at this time is the health and safety of individuals. So we have asked for voluntary cooperation. Now, if you read Executive Order number 5, we did receive guidance at the health department that ordered us to enforce the governor's guidelines as the public health department, because this is a public health issue. So we are doing our best to enforce that. We are also a limited staff, but I can tell you that almost all of the businesses that we have been working with, especially over the weekend when the phone was just ringing off the hook, have been so cooperative. We have businesses calling us continually, day and night, asking us, you know, how should we set up this? How should we be screening our workers before they come to work? So we've been providing those guidelines with them. We've been assisting them with screening tools. We've been assisting them with getting a hold of thermometers, you know, things like that. So I really believe that we are very fortunate to live in the community that we do, because I do think that not only the community at large, but also our businesses are taking this seriously and doing what they can to prevent the spread of this disease. And for that, I am extremely grateful.
Thank you, Dean. Questions, please. If there are no further questions, any final statements from the panel? Then I'll just, did you have anything?
Just one last reminder,
Go ahead.
if you would, Eric, to remind them about the Facebook page.
Sure.
For accurate and updated information.
Please do remember that for this situation is fluid, and we will continue informing the public as things continue to change. And for updated information, you can find that on the Iroquois County Public Health Department's website and their Facebook page. Please share those Facebook posts so we reach as many people as possible. And of course, the media will be informed regularly. Without any further questions, no further statements, that's all we have. Thank you, folks.
Thank you.